Hey everyone, this is Stephanie Taylor, and this is the Week 3 Voice Discussion post. So this week we were asked to go to the Department of Health and Human Services website, and we were asked to talk about one of the programs that's listed under their agencies. So I have put together a slideshow presentation to go over the topic and program that I chose to discuss. So here you'll see the Department of Health and Human Services main website. And if you scroll down to the bottom, you're going to see an area that says Explore Our Agencies. And there's a lot of different agencies here. Some are very familiar. So you see the CDC and CMS, and then there's one called HRSA. And this is for the Health Resources and Services Administration. And if you click on that, it will take you over to HRSA's website, and you can learn more about HRSA, but I'm going to focus in on the bureaus and offices. So you click on that tab, and it's going to take you to the different bureaus, and there's a Bureau of Primary Health Care here, and you see that it says that the Bureau of Primary Health Care operates and oversees the health center programs, and this is basically a national network of health centers that provides comprehensive primary health care services for patients regardless of their ability to pay, charging services on a sliding fee scale. So when you click on this tab for the Bureau of Primary Health Care, it's going to take you to the Health Center Program. And you're going to see here a little bit of history about the Health Center Program and the different centers and sites that are here in the U.S. and the patients that are served through this program. And down at the bottom, you can click on the Learn More About the Health Center Program. And this is basically going to tell you about the health centers and what the health center is. So health centers are community-based organizations that deliver primary health care services to some of the more vulnerable patients in the area. So this can be patients that are homeless, agriculture workers, residents of public housing, and veterans. And so basically health centers are able to provide access to these patients for pharmaceutical services, for mental health services and substance abuse, oral health services, and these are all services that are provided in areas where there may be economic or cultural and geographical barriers that limit these patients' access to healthcare services. And so if you scroll on down, it tells you about the health center fundamentals. And so basically some of the things that the health centers are required to provide for patients are, first of all, comprehensive, culturally competent, high-quality health care. That can include education, translation services, and transportation. Services regardless of a patient's ability to pay, and charging for services on a sliding fee scale. So this is a big part of the health center program, is that you have sliding fee discount programs where patients are able to apply for discounts to their health care services, and it's based on their income. So maybe if you have a patient who's not working right now and they don't have any income, they're able to get their services on a discounted scale. The next thing here says, patient-centered and integrated care that responds to the needs of the underserved areas and populations in the community. So again, there we're talking about the homeless and the migrant populations. And then health centers are required to operate under the direction of a patient majority governing board. And so this is really neat because it requires that over half of the board members have to be patients who are receiving services through the health center. So I think that's really important because they're able to receive services there and then provide input onto how these services will be provided. And the last tab here just talks about meeting requirements regarding administrative, clinical, and financial operations. And I did not click on the tab for this PowerPoint presentation, but if you do, it's going to take you to the HRSA compliance manual, and that manual will just give you certain requirements that health centers are required to follow in order to receive funding through HRSA. And so this includes different things like their requirements for the board members, the budget, how often it has to be submitted to HRSA for approval, It talks about the quality improvement and quality assurance programs that your health center has to have in place. And one thing that I wanted to point out, because we did the windshield survey last week in Shadowville, is a needs assessment. So that's something that HRSA requires health centers to do every 3 years. They're required to collaborate with other organizations in the community, and they have to look at the different needs for the community and address the highest priority areas. And so whatever those areas are, they have to submit proof to HRSA of how they're working on improving those needs within the community. And then lastly, here you'll see how health center programs work. So this talks about the different things that the health center programs are able to provide. So federally qualified health centers, they receive reimbursement services for beneficiaries of Medicaid and Medicare. The 340B drug program provides discounted pharmaceutical products for patients, and so that means that patients are able to apply for their medications through the health center at discounts or sometimes free. Free vaccinations for the uninsured and underinsured children, and then also assistance in recruiting and retaining providers. And then lastly, there is the Federal Tort Claims Act. And this is basically just a program that provides medical malpractice coverage for the health center. So as long as the health center is following all the requirements, they are able to receive, if they submit an application, they're able to receive this coverage. And if a patient for some reason decided to bring a claim against the health center, it would actually not be against the health center or providers there, it would be against the federal government. And so down at the bottom, there is a Find a Health Center tab. And if you scroll down and put in your zip code, it'll bring up different health centers and sites within your area. And so since I am from Kinston, I put that in. And it will bring up a list of the different service areas over on the left. And of course, I have chosen to highlight Kinston Community Health Center because this is where I work. And so I'm going to go to the health center website for Kinston Community Health Center. And so here you can see on the front of the website page, we have advertising here for our OBGYN services. And at the top, you have different tabs that you can click on that just provide more information about the health center. And one that I'll just draw attention to for a second is the school-based dental program. And so basically, we have a program for dental services, and we have a dental van that goes out to the schools in the community, and we're able to provide dental health care services to those patients at school. So that's a pretty neat program that we're able to provide through our health center. And here's just another screenshot of the health center's website that shows the different services that we have. So you can see family medicine, pediatrics, behavioral health, dental services, and women's health. And there you'll see we have a little logo that shows that we're accredited and we are a federally qualified health center. And so here's just another screenshot of the health center's website. And at the bottom it says the health center is a health center program grantee and deemed a public health service employee. And so, of course, I chose to talk about this program because I work at a federally qualified health center. But I'm very thankful for the services that we're able to provide for our patients in the community. And this is because of the grant funding that we're able to receive through HRSA and the Bureau of Primary Health Care, which is, of course, an agency of the Department of Health and Human Services. And so in thinking of scriptures to apply to this, Galatians 6:2 says, "Bear ye one another's burdens, and so fulfill the law of Christ." And so when we're able to think about the different burdens of our patients and the barriers that they have to overcome for their health care, I'm very thankful for the programs that we're able to provide to the patients and able to help share in the burden that they have by helping them overcome these barriers to receive health care services.